Other conditions that may be a focus of clinical attention. Conditions in this section are not mental disorders, but are relevant insofar as they may warrant clinical attention or influence diagnosis, course, prognosis, or treatment of a mental disorder. Conditions listed in this section may also be helpful in coding the reason for a patient's visit or clarifying the need for a test, procedure, or treatment. Relational problems. Important relationships such as between intimate adult partners or child and caretaker can have a significant impact on an individual's mental well-being. These relationships may be a positive, neutral, or negative impact upon mental health. In severe cases, the negative impact of relational problems can have significant psychological repercussions upon the individual affected. Problems related to family upbringing. Parent-child relationship problems, sibling relational problems, upbringing away from parents, child affected by parental relationship distress. Other problems related to primary support group. Relationship distress with spouse or intimate partner. Disruption of family by separation or divorce. High expressed emotion level within family. Uncomplicated bereavement. Abuse and neglect. Mistreatment by significant others deserves clinical attention when such mistreatment is a key consideration in the diagnosis and treatment of people with mental or other disorders. Conditions in this section may warrant important legal considerations, and the past history of repeated occurrences of abuse and or neglect may also be noted along with the diagnosis. Child maltreatment and neglect problems. Child physical abuse, child sexual abuse, child neglect, child psychological abuse. Adult maltreatment and neglect problems. Spouse or partner violence, physical. Spouse or partner violence, sexual. Spouse or partner neglect. Spouse or partner abuse, psychological. Adult abuse by non-spouse or non-partner. Educational and occupational problems. Educational problems. Conditions in this section are relevant when academic or educational difficulties warrant the need for clinical evaluation or influence treatment, diagnosis, or prognosis. Problems addressed may include academic underperformance, underachievement, and problems with teachers, staff, or students. Also worthy of consideration are issues related to illiteracy or low literacy, and any other problems stemming from education and or literacy. Academic or educational problem. Occupational problems. Conditions in this section are relevant when occupation-related issues warrant clinical evaluation or influence the individual's treatment or prognosis. Individuals involved may include work or work-related stress, difficulties, getting along with superiors or coworkers, sexual harassment, loss of a job, changes in job conditions, and ambivalence about career choices. Problems related to current military deployment status, other problem related to employment. Housing and economic problems. Housing problems. Homelessness, inadequate housing, discord with neighbor, lodger, or landlord. Problem related to living in a residential institution. Economic problems. Lack of adequate food or safe drinking water. Extreme poverty, low income, insufficient social insurance or welfare support, unspecified housing or economic problem. Other problems related to the social environment. Phase of life problem. Inclusion in this category is appropriate when issued pertaining to a lifestyle adjustment or transition warrant clinical attention or influence their treatment. Relevant issue may include retirement, children leaving home, marriage, having children, and starting or completing an educational phase. Problem related to living alone, acculturation difficulty, social exclusion or rejection. Target of perceived adverse discrimination or persecution. Inclusion in this category is appropriate when the individual perceives or experiences instances of discrimination or persecution that appear to be due to their membership or perceived membership in certain groups such as race, religion, gender, ethnicity, sexual orientation, political affiliation, disability, social status, weight, or appearance. Unspecified problem related to social environment. Problems related to crime or interaction with the legal system. Victim of a crime. Conviction in civil or criminal proceedings without imprisonment. Imprisonment or other incarceration. Problems related to release from prison. Problems related to other legal circumstances. Other health service encounters for counseling and medical advice. Sex counseling. Inclusion in this category is appropriate when counseling is sought in relation to sex-related issues such as the individual's sexual behavior, satisfaction, attitudes, orientation, or education, as well as similar issues pertaining to the individual's partner. Other counseling or consultation. Inclusion in this category is appropriate when the individual seeks counseling for issues not elsewhere included, such as religious, spiritual, or existential concerns, dietary issues, or attempts at smoking cessation. Problems related to other psychosocial, personal, and environmental circumstances. Religious or spiritual problem. Problems related to unwanted pregnancy. Problems related to multiparity. Inclusion in this category is appropriate when issues pertaining to multiparity are deserving of clinical consideration. Such issues may include relational complications among siblings who are twins, triplets, or other multiparity groupings. Discord with social service provider includes probation officer, case manager, or social services worker. Victim of terrorism or torture. Exposure to disaster, war, or other hostilities. Other problem related to psychosocial circumstances. Unspecified problem related to unspecified psychosocial circumstances. Other circumstances of personal history. Other personal history are psychological trauma, personal history of self-harm, personal history of military deployment, other personal risk factors. Problem related to lifestyle. Inclusion in this category is appropriate when issues specifically related to a type of lifestyle warrant clinical evaluation or directly impact the course, prognosis, or treatment of a mental or other medical disorder. Lifestyle issues addressed may include poor fitness and inadequate exercise, high-risk behaviors, sleep-related problems, and dietary problems. Adult antisocial behavior. Inclusion in this category is specifically warranted when adult antisocial behavior is manifested that is not due to a mental disorder, such as antisocial personality or conduct disorder. Examples of these types of adult antisocial behavior may include drug dealers, members of organized crime, professional burglars or thieves, and individuals engage in racketeering. Child or adolescent antisocial behavior. Inclusion of this category is warranted when the antisocial behavior of a child or adolescent warrants clinical evaluation. Such behavior is not due to a mental disorder such as a conduct disorder or intermittent explosive disorder. Behaviors in this category may be distinguished in that they appear to involve the commission of isolated antisocial acts and do not appear to form a pattern of such behavior. Problems related to access to medical or other health care. Unavailability or inaccessibility of healthcare facilities. Unavailability or inaccessibility of other helping agencies. Non-adherence to medical treatment. Conditions in this section are relevant when issues pertaining to non-adherence or non-compliance to a prescribed course of treatment for a mental disorder or other medical illness warrant clinical evaluation. Issues may include non-compliance due to disagreeable side effects of prescribed medications, personal, moral, or religious objections to treatment, or the presence of a mental disorder contributing to non-compliance. Non-adherence to medical treatment, overweight or obesity, malingering, wandering associated with a mental disorder, borderline intellectual functioning.